Hello, I'm Dr. Remcha. I'm one of the doctors here. Are you Ralph Carter?
Yeah, that's right, doctor.
Hi, Ralph. It's nice meeting you. Just confirming your age, you're 41 years old?
That's right.
Nice meeting you, Ralph. I can see from the notes that the last time you come up with a low mood and we're following up on how things have been going on. Is that right?
That's right, doctor. And then you sent me for CBT and it's not working. CBT is just rubbish. It doesn't work.
Yeah. I'm really sorry to hear that you've had that response. Um, we'll just like to delve into things and find out what's been going on recently. Is that all right with you?
That's all right. But the last time I came here, I told you all about, what was going on. And now you sent me for CBT and that's not working. And I need something better. I
Yeah.
can't go on like this.
I'm really sorry to hear that the CBT wasn't really effective, and we can definitely find out strategies of how to make things better for you. But just in order to understand your situation better, I need to ask you a few questions so I'll be able to understand things better. Is it okay?
Yes, sure.
Sure. Just regarding your low mood that you came up with last time, I'm sorry to discuss all these things again, but would you like describing what's been going on recently?
I mean, it's been the same. I find it difficult to cope with work. I
Yeah.
went on a date and I had no interest in sex and I,
Yeah.
I've been I've been just low
Yeah.
mood.
I'm so sorry to hear that. That seems like a toll on you. And since when has been going on?
It's been 4 months, doctor. It's been 4 months since I divorced my wife and this all started then. And I don't think I have actually recovered from that. I'm
Okay.
finding it very difficult to move on in life.
Yeah, I can see big changes in life brings on big moods as well. And how has your mood been recently from a scale of 1 to 10? 10 being the happiest.
It's been terrible, doctor. I don't know, I would say around 4.
Oh, really? That's really a really bad score. But regarding your appetite and your sleep, how's that going? Is that affected as well?
I don't get much sleep, but
Yeah,
my appetite is fine.
yeah. And do you think it's also creating feeling of worthlessness?
You can say that.
Okay.
Otherwise, I'm finding it very difficult to come to terms with everything around me.
I'm
Like the
sure.
only thing I do actually is, with a bottle of whiskey.
Yeah,
It actually works now.
yeah. And is that the way that you're trying to cope up with the stress by drinking alcohol?
Well, that's the only thing that seems to work. It's not like
Yeah,
CBT did any good.
yeah. And do you think that actually helps you out?
I do actually. It does
Yeah,
help me.
yeah. All right. And would you mind telling me how much do you drink to help with that stress?
Well, like I mentioned, probably a bottle a
Okay,
day.
sure. Okay. And do you feel like it's affecting your work as well with the current mood that you're in?
I mean, definitely, I'm unable to concentrate. I'm unable to focus at work.
Mm,
And
okay. Yeah,
I don't. I really am coming to you for some help to,
yeah. Definitely,
help me
definitely.
with this.
I'm sure we'll be able to help you out. But have you tried talking to anyone else in your family, maybe like family or friends?
It won't work, doctor. That's not something that I want to explore. I mean, there were a lot of bitter situations in the relations that have happened, and I don't want to go through with that. I mean, isn't there something that you can help me with
Yeah,
apart from therapy? Because that seems to not really work.
yeah. I'm sorry that you're having that experience. But just a few more questions I'd like to ask regarding your general health. How have you been regarding any medical conditions that you have?
No, doctor.
Great. Any medications you've taken or tried?
No, doctor.
Okay, all right. And just a very important thing I'd like to ask, just when people are feeling really low, they try doing things that are not really nice. Maybe they have this thought about harming themselves or maybe someone else. Has that thought ever come to you?
No, doctor.
Really, I'm glad to hear that. And just regarding the whole situation, um, do you think you need help?
Definitely. I mean, that's why I'm here today.
Yeah, definitely.
Anything that you can do for me, I'll be very grateful.
Yeah, sure, sure. And just regarding the current CBT that you've had, what are your response? Do you think it's not effective at all?
I mean, I've been for like 4 to 5 sessions and nothing has really changed. So I
Yeah.
would definitely say it's not working.
Okay. And have you tried changing maybe something in your lifestyle regarding maybe thinking about cutting down on the alcohol or having some physical activities?
I mean, I've lost interest in any of this physical activities. I
Mhm.
used to play football and that's not working, doctor. In fact,
Yeah.
alcohol is the only thing that's getting me through the day and I can't be cutting down.
2 minutes remaining.
Yeah, okay. Ralph, I can understand there's a lot going on, and I'm sorry to hear that the CBD is not working for you at the moment. What we can do at the moment is maybe try giving you some antidepressant medications. So these medications will basically help you to cope up with things, but they might not be effective for maybe even 2 weeks. So it might take some time for them to be effective, but we can try those things out. However, there's some side effects associated with it as well, regarding increased sleepiness, or maybe dependence on that, and we don't want that to be happening. So at the same time, we would want the talking therapy to continue, and maybe you can try on taking some medications to help out with the anxiety. Do you think that's an effective plan?
Yeah, but medications, I've heard that these medications will kind of, worsen my performance in bed. I don't want that. I just want to move on in life.
Yeah, I can understand your concern, but at the moment, the basic thing is managing your mood, and I can understand that you want to perform well as well. But at the moment, it's better to make your mood better, and maybe taking some medications for the moment is going to overcome your low mood and make you feel better, and then you can focus on the other things as well. But at the same time, I would always want you to come back to us if you feel like you're having thoughts about harming yourself, or having thoughts about harming anyone else around you, or you're just not generally feeling well. I would always want you to come back to us.
Okay, doctor.
Yeah.
Sure.
And maybe we can arrange a follow-up within like 2 weeks to see how the medications are working, and we'll get some blood tests
Move on
done
to the
as
next
well.
station.
All right,
Okay,
Dr. Rusa, that was good.
sure.
So we'll move on to the next scenario.
Sure.
Right. So let's look at the depression case. So yes, so this patient came in saying that depression, CBT is not working, right? So definitely understand the current condition of the patient. So you went about, what aspect of CBT is not working? Did they give you any lifestyle changes? I mean, that's not something that you would be so worried about because you're not the one who's providing the CBT, right?
Yeah.
So even if they've gone for those sessions, they are not working. You won't be even telling the CBT people saying that specifically this is not working. So
Mm.
you would actually try to understand what is his current scenario because sometimes CBT might not help. So you need to understand the extent of depression that he is in. The severity of depression is what what you're needed to find out. So the
Mm.
two important questions for depression is mood and anhedonia,
Yeah.
right? But you explored other things like guilt, self-worth, and then he also mentioned that he was kind of addicted to drinking, some coping mechanisms. So yeah, and so those are very, those kind of questions kind of give you an idea of what is the extent of depression that this patient has. And it seems like he could be having moderate depression because at this point he doesn't have any suicidal tendencies, right? Suicidal or self-harm tendencies, which you also ruled out, which was very important. That's very good because any depression case, given any stage of depression, you should definitely rule out self-harm
Yeah.
and you should bring it back at safety netting.
Yeah.
Because if a patient is depressed, cannot leave your consultation without giving the management of what to do if they fall into the feeling of self-harm. That is something that you ought to be giving them. Because if this patient has come to you for consultation and the next thing you know, within a week, he is kind of offed himself, that would be on you because you didn't give the right kind of management. Because they'll go back to your notes and see whether or not, you gave him what to do, the safety netting, or what to do if such a situation arises.
Yeah.
Right? So always do not miss that out. And that is something that you covered. That's very good. In fact, we also mentioned in all our mocks that 3 things that you should definitely do for management is safety netting, follow-up, and leaflets and pamphlets. So those are something that would just give you marks because NHS has leaflets and pamphlets for everything. Even the gender dysphoria case also, you could have given her some leaflets and pamphlets so that she would understand a little bit more about the condition, right?
Sure.
Leaflets and pamphlets will cover a lot of things for you in management. Even if you don't have time to do a lot of things in management, if you mention that I'll give you reading material, I'll give you resources that you can go through, which will basically contain everything. That will give you the resources will have the diagnosis, what it is, and what are the lifestyle changes that they can do, and what are the support groups that are available, and what are the safety warning signs they need to look out for. Everything will be there in the leaflets and pamphlets. So that's one thing that you can actually cover, mention, even if you don't have time to mention anything else.
Okay.
Right. So symptoms, definitely understand the mood. Anhedonia, you didn't try that. Fatigue, sleep disturbance, yeah. So I would also give a partial for this. So assess the duration and the impact. That was done properly. Investigate any previous episodes of depression or mental health. So, that would be something that you would want to understand, like, do you have any family history of depression or any mental health issues? Or this is a recurring thing that happens for you, or this was just like a, isolated incident where you're feeling this way.
And other mental health conditions. So you didn't really ask about anything else. So there could be psychosis, there could be other, situations that other mental health conditions that could be, leading to depression. So you should always. So one main thing is psychosis because depression. So within depression, there's 3 types of depression. There's like normal, mild, moderate, severe depression. There's a severity. And after severe depression, there's something called a psychotic depression. So, which is basically depression at a very severe stage will lead to psychosis. So, that is something that you should definitely rule out. So, that's a part of checking the severity as well.
Oh, okay. So with psychotic depression, what would we ask? Like delusions, hallucinations? Is it?
Yeah, just one question is fine. It's like, do you feel like you hear things or do you feel like you see things that are not happening? That's enough.
Or nobody else is seeing, like
Yeah.
any of the hallucinations or, yeah. Or do you feel like someone is out to get you, someone is out to harm you,
Yeah.
And the other thing is risk factors, family history, recent stressors, substance abuse. Yeah, you asked all those questions. That was right. Current medical history and any recent changes. You got a partial for that. Why a partial?
Any recent changes in medication? So you asked, are you on any medications right now? But you need to ask, were there any medications that were stopped? So was he, if he was on any antidepressants and they were stopped, that could be leading to the depression, right? So you should always ask past medications. So like anything that is happening right now, change. You should always ask, is this happening because of a medication change? So, like you asked, are you on any medication right now? Instead of asking that, is there any regular medications now or before? So, like only in this kind of case where you're seeing sudden change in, either mental health or normal health, physical health.
Sure. Okay.
Right. And advice on, all right. So that was all for data gathering. So now management, definitely explain to him that this is a depression situation. Rule out any self-harm. Consider antidepressants. So this is a phase where you were trying to take on a lot on yourself, right? So this is when you realize that there is so much to do. This seems like a little complicated case. Just refer the case. Like I will get you in touch. I'll write a referral to the psychiatrist who will be seeing you and can prescribe you some medications. But I'd like to tell you some things about this medication is that it wouldn't act, right away. You have to continue having them for a duration of 6 months for them to show, any real effect. So we may come. You did mention some of the side effects, but sometimes you can always ask in between, like, do you have any questions? Do you have any concerns? Because side effects also can be so extensive, you might not actually cover all the side effects. So one of the questions that I had was, if I was given SSRIs, would I be able to perform properly? Would I be able to perform sexually? So you didn't mention that in the side effects, but then when you asked me, do I have any concerns, that came out. Right. So whenever you say, a management plan, whenever you mention a management plan, always try to ask the patient how they feel about it. Does that sound right? Do you have any concerns? Right. So that way, if they have any immediate concerns, you can actually understand that.
Sure.
Like,
Okay.
charted a management plan. So another management plan that you could have offered to this patient was a more intensive CBT.
Yeah.
Right. There could be a more one-on-one CBT. If you see in the question, it said mild CBT.
Yeah.
Mild depression and cognitive behavior therapy. All right. But there are more, more higher grade CBT that you can have offered. So since this is not working, I can actually put in a word for a more intensive CBT, if that could help you.
Sure. Okay.
And apart from that, you can always have family therapy and non-medical management side of things. Family therapy and yeah, I guess that's about it. Any lifestyle changes, because you've uncovered the fact that he is taking alcohol. So you didn't bring that
Yeah.
back in management, because this is something that's really aggravating his case. I mean, I kept saying that this is the only thing that gets me through the day, but you have to bring that fact that that's actually a temporary solution, which is not really a solution, right? It just gives you temporary relief, but it doesn't do anything for the underlying condition. So we need to actually improve your life. We need to improve your lifestyle as well, right? And that is something that can help you further rather than going deeper into this. So then you need to advise. So that is something that you uncover the issue. Then he's drinking alcohol. So you have to bring that back in management. Say that these are the factors that are actually, aggravating your situation, that are, not benefiting your, situation or worsening your condition. So, you need to do that. And you understood that he used to play football before, but now he doesn't play that anymore. So then, bring that back in management. Try doing more activities. I understand that, you don't feel like it, you don't find any joy in it. But
Yeah. Sure. Just with this current situation, I know he had low mood. Do you think I should be exploring around of why he was diagnosed with low mood? Because I felt like I was trying to explore around what's been going on with him previously, which maybe took some time for me as well. Or do you think once he's been diagnosed with low mood, should I talk a bit more about it, or should I move ahead just to exclude out the red flags and then move on with the management? Because I felt like I was exploring more on the low mood and trying to grade the mood now again. Do you think I should have
right.
changed the strategy?
So I would say definitely understand why the low mood is, because you're trying to understand if this is an isolated incident, did something actually happen, or is this a medical condition? Does he have any psychiatric or medical problem? Right?
Yeah.
He could be having, say, this low mood. If a person is actually suffering from a terminal condition like cancer, they could be in a low mood. Then, it's a good question to ask that, did anything happen for you to feel this way? That's just one question. So that way they'll actually tell you the initiation of why they are feeling this way.
Yeah.
Or is this a recurring feeling? That question itself will just give you might not need to actually understand more about it. And then you go into understanding severity. So the severity, basically 2 questions, which is the mood and the anhedonia.
Yeah.
Right. So with mood and anhedonia, you understand this is a depression case, right? And daily activities, how well are you able to do the daily activities? So if it's affecting the daily activities, then it becomes moderate. But then if it goes on to suicidal or self-harm tendencies, then
Yeah.
it becomes severe, right?
Yeah.
So, that's enough. So probably say 4 questions tops.
Okay.
And that would be very quick. So definitely you understood this was low mood, this was depression. So understand why this happened, because you need to understand what is actually causing this. Any of the symptoms that you have, you need to understand the root cause. Even if it's a headache, you need to understand what is causing the headache, right?
Yeah. Fair.
You need to understand, then would you be able to give the management. Even in this case also, even if you're able to understand the root cause, it would help you with your management.
Sure.
Formulate and deliver it properly,
Okay. Fair.
right? Then support groups, community. So that's another non-medical aspects that you could offer. And then definitely, finally, all the safety netting follow up and leaflets and pamphlets. So I think that was done properly. You managed to do safety netting.
So in this safety netting in depression, you always have to do something called a crisis plan. So,
Yeah.
which is very important. You always have to mention that. So, I'd like to. So, see the word crisis plan. I like to lay out a plan. So for future, if you have any crisis. So, if you feel like you are, if you feel like your mood is low, or if you feel like you can't cope with it, I'd like you to make plans so that this doesn't happen. So you always reach out to family and friends. So you give a 24-hour helpline that you can call. So set these things out, and that is something very important in depression case. Always have to. That's your safety netting basically.
Yeah,
Sure.
this is safety netting for suicide. So basically, if you feel that you are having any suicidal ideations, make sure to actually talk to somebody. Have a plan of what to do then.
Yeah.
And or else you can call the 24-hour helpline number where you can talk to someone.
Mm.
Because that's one way, you can actually avoid people from doing something very drastic at that point of time.
Yeah. Fair.
But yeah, I guess that was great. So are you ready for your second attempt, Dr. Vishal?
Yeah.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.